first of all, a very healthy World Heart Day. As you all know, the incidence of heart disease, they are on the rise, not only in India, across the world, across the globe, and they are happening at younger age. Uh, so really, this is a big problem, huge problem. A lot of news about the young patients dying from the heart diseases every day or the other day, which surprises us. So today, to answer all those questions, to answer all those risk factors, we have a very renowned cardiologist, Dr. Amit Sharma, with us, who will answer all of our queries and increase the awareness on this World Heart Day. So, Dil Ki Baat is an initiative to actually increase the awareness about the heart diseases which our population is facing on today and on this day. What better day can be to talk about them on this day? So we will be asking few questions right directly from the horse's mouth, and they will be answered from Dr. Amit Sharma directly, and hope that will solve a lot of queries which are there in your mind, and what we can do to actually decrease the risk of cardiovascular diseases day in and day out.
Thank
So,
you,
well,
Dr. Paramveer.
so Dr. Sharma, a warm welcome to you
Thank
to
you.
have this nice conversation
Okay.
today, and we will be, I think, we will have a lot of question answer today while this conversation goes on. So, Dr. Amit, as I was talking earlier, so there is a really a huge concern about the increase in heart diseases in our population, and especially in the younger subset. So, what are your views about that? So, how to go about the things actually?
See, actually, India is now a major country where the incidence of coronary artery disease is very high, and it is especially in the young Indians. And what we have seen nowadays that young people, young adults, even the gym persons are coming to us with coronary artery disease, having myocardial infarction, chest pain, angina, etc. Actually, India has something different from the Western countries, as we all know that South Asia has higher prevalence of cardiac disease, and these are genetically predisposed, as well as the food habits, stress, and the incidence of diabetes and obesity is particularly high in our area. So I think it's a very increasing at a very high rate, and it's very demanding that we should educate the person as a whole, pupil as a whole, because without this we cannot prevent. The treatment of cardiac coronary artery disease is not so much effective that we can make a person healthy for a life. If you have cardiac disease, then maybe that after few years of angioplasty or bypass surgery, you will have to undergo a second procedure or third procedure or vice versa. So it's a continuous process. So we should know how to prevent it, how to go with it, and how to detect it, diagnose it, and treat it.
Absolutely, well put in the words, डॉक्टर अमित. एंड वो एक कहावत है हिंदी में हमारी कि भाई बचाव बेहतर है इलाज से.
Yeah, prevention
So
is better than cure.
बिल्कुल, तो आपने बहुत ही बढ़िया तरीके से हमारे को इस बारे में अवगत कराया है. और डॉक्टर में आपने रिस्क फैक्टर्स की बात की, इतने सारे रिस्क फैक्टर्स आपने गिनाए. आपने स्पेशली ये कहा कि भाई जो पेशेंट्स यंग दिखते हैं, जो फिटर भी दिखते हैं, जरूरी नहीं है कि वो हेल्दी हों, तो उनको भी अपना ध्यान रखने की आवश्यकता है.
Definitely.
और रिस्क फैक्टर्स उनके हो सकते हैं जो उनके दिल की बीमारियों में कारक बन सकते हैं. डॉक्टर में जैसे आजकल हम सुनते हैं कि कोई जिम कर रहा था, 18-20 वर्षीय व्यक्ति, और उसको सडन कार्डियक डेथ हो गई. तो ऐसे में लोगों को वो एक न्यूज़ बनती है और लोग उसके ऊपर चर्चा करते हैं. तो आपके क्या ख्याल, मतलब लोग किस तरह से इस चीज़ों को लेते हैं?
See, these things are common previously also, but nowadays we have better CCTV coverage, better mobile connectivity, better mobile news, etc. Everywhere we can make a video of anything. So these things are exposed to the general population. Doctors previously also knows that this is a common presentation of sudden cardiac death in young. Actually, young pupils are at higher risk of sudden cardiac death because just after myocardial infarction they got VT, VF, and even hypertrophic cardiomyopathy is more prevalent in the young pupil rather than in the older, yeah, elderly pupil. So I am not saying that incidence is not increased in younger pupil, but definitely the exposure to media and everything goes beyond a level that causes stress in every young person, that whether I am suffering from cardiac disease or not.
Absolutely, Dr. Amit. So, you mentioned that. So, Dr. Amit, what about the? Here comes the play about the genetic factors or genetic
Yes,
risks
definitely.
also in these patients. So, and as we all say day in and day out, that in South Asian population, genetics really play an important role in this increase of the cardiac diseases. So, how you look at it? Like,
See,
yeah,
genetics is very important factor and it is a non-modifiable factor like age. We cannot modify genetics, we cannot modify age. And we have seen that the age of father having coronary artery disease is 55 and 60 years, but his son is coming at 25, 40, 30, 40, means at least 20 years before than the father. So really, and I have seen in other disease also. Like we see the disease in father, diabetes, say type 2 diabetes in father, mother at the age of 55, 60. But the son and daughters are presenting at the age of 30 and 35 years.
at least decade or
So the
two.
genetic predisposition increases the incidence at an early age, at least 15 to 20 years, in my opinion.
And as
And
you
also in the studies it is shown.
Yes, Dr. Amit. Yes. So as you mentioned, Dr. Amit, that in these younger patients, the disease is increasing. I'm talking about the heart disease today, especially. So and it is more carrying more mortality. The disease is more severe, and the death rate is higher. Absolutely right. And that is why it becomes a news actually
Yeah, yeah.
also because it carries a high
Yeah,
mortality.
it's very surprising to see a patient on treadmill and he's just get collapsing. It's very shocking also.
Absolutely, it's suffering for the family, suffering for
Yeah,
the.
yeah.
It's
He's the
painful for.
most potential earning member of the family and he's going just like that is not
Absolutely,
really.
and for doctors also to watch these
Yeah,
visuals
yeah.
is painful.
Doctors are at also very stressed because how they can treat a patient who is just collapsing and the
Given no time.
outcome is very poor and such a young person, it's very difficult emotionally as well as by treating also.
So, Doctor, you mentioned about the risk factors such as diabetes. You recently mentioned. So, diabetes. We know that in our population, diabetes is skyrocketing like anything. The prevalence of diabetes is increasing, and the contributing factor can be the carbohydrate-rich diet, the obesity, the central obesity, or stressful lifestyles, inactive lifestyle. All these factors can increase the risk of diabetes, and that can increase the cardiovascular or the heart disease. So, so to mention the other risk factors of hypertension included.
Yes, yes, definitely. Actually, if we see in India, every 8th and 9th person is diabetic now. And adding on hypertension, which is undetectable, not treated properly, is also a risk factor. Other thing is that patient is a smoker, sedentary lifestyle, stressful lifestyle, eating junk foods, processed food, red meats, fried foods. So these are really makes a lot many risk factor collectively. And as we know that diabetes increases the risk of coronary artery disease by 2 to 4 times. But when it is added up with smoking, it is 8 to 12 times more harmful and more dangerous to having coronary artery disease. So when these all risk factors are collectively added, then they makes a patient at a very high risk, even at the younger age.
Absolute, Dr. Amit. So summarizing your words, I should say, so diabetes, hypertension, smoking, and all these pollution, even
Even
air
pollution.
and water and sound pollution, all these collectively together with the genetic
Yeah,
factors, and
definitely.
which is very high in our population. So that, especially in South Asians, isn't it?
I
That makes it very
remember,
risky.
I remembered my consultant, Dr. Harshvardhan, 15 years back in RML hospital also, when he told me that Amit, there is at least 15 or 20 other risk factors which we didn't know at this time. So definitely there are other risk factors also that we don't know, that we can't prevent. But at least we should prevent these which we know. At least we should control our diet, our exercise plan, our blood pressure should be controlled, and we
Absolutely.
should live stress free at least.
And to make the things complicated, Dr. Amit, I think, for example, take blood pressure, high blood pressure. It is such a silent killer. I mean, the
Yeah,
patient
yeah,
doesn't
definitely.
know that having a
Another
blood
name
pressure.
of hypertension is silent killer, and patient used to say कि डॉक्टर साहब जब बीपी बढ़ता है बस मैं तो तभी दवाई लेता हूँ. That is the education of our system. So we should educate the patient. नहीं भाई, if you have blood pressure, take medicine regularly. If you have diabetes, take medicine regularly. Follow regularly, because by following to a doctor, you are not spending much more. Once you admitted, the burden and cost of the treatment is very high.
Absolutely. So, Dr. Amit, the economics of the diseases actually says that if you prevent a disease and spend 100 rupees, so once you get the disease, you will be spending 1,000 rupees,
Yeah,
or 10 times the spend you spend on preventing the disease. And if you get a complication, for example, advanced heart failure or advanced liver failure or those things, you spend 10 times even more than that. So 1,000 rupees, so it increases to almost 100 times.
that is why it is necessary for the younger people to come to the doctor early before having the disease, just as a friendly visit. I don't want to say it's a doctor to patient visit. It's a just friendly visit ki doctor, how can I decrease my risk? Because prevention is the best thing.
And especially the patients, Dr. Amit, those who have a family history, strong family history, or those who at least know that they have raised blood pressures or raised blood glucose values, they are impaired or maybe impaired glucose values. So they should at least come in at
Yeah,
least.
it is also now known that diabetes start having deterioration in the body 5 to 10 years earlier than it's overt
Detected.
detected.
And especially in the developing countries like us, we
Yeah.
have a late diagnosis.
Yeah, usually patient comes at the level of 300, 400 blood sugar, and that is very late.
Absolutely. So higher HbA1cs, higher blood pressure, not even higher blood pressures, or they may come with left ventricle hypertrophy, as you always mention in
Yeah,
your
yeah,
reports.
echo
So
reports.
these are the patients who already have complications when they are presenting to you. Uh,
I have seen many young gym going patients who are on protein supplements. I don't know what they eat, but they have myocardial infarction, cerebrovascular accident, which we call paralysis. And recently, I have seen a patient from nephrologist who is having kidney failure. So we should eat properly. We should eat fruits, vegetables, and we should remember 3S: seed, salad, and sabji. So these are the seed is nuts basically, and salad and sabji, vegetables and fruits are very good source of antioxidant and to prevent cardiac disease.
So absolutely, Dr. Amit, as you are again and again mentioning that exercise is not everything when it comes to prevent the cardiovascular disease or the heart diseases. We should pay attention to our diet also, sleep also, and
Yeah,
everything,
definitely.
Dr.
Good
Amit.
sleep is best.
Good sleep, genetic factors also, screening also, as you said. And you said like not only screening and take a proper advice from the cardiologist actually. I think today's this effort is a is an effort to increase the awareness, talk about all these things, so they are
Yes,
done in
definitely.
the society more and more.
We should do such type of education talks. Really, these will
Absolutely,
benefit the general population as a whole.
absolutely,
Because nowadays media is very much progressive and proactive. They are showing more of the death on the treadmill, but they are not showing their such talks and such informative things.
very valid point made, Dr. Amit, that media can play a very huge role in the awareness. And like in everything, Dr. Amit, whether it is politics or whether it is another sphere, is in the healthcare, media can play a very vital role. And awareness is the thing which spreads
And that's
slowly.
why we are here.
And that's why we are here actually, Doctor. So, Dr. Amit, now I often hear about the about the link of the heart diseases with the post-COVID scenario. We know we had this epidemic, this pandemic in 20 and 19. So, what about the link? How should we perceive? Is there really a link between the increase in cardiovascular disease
Yeah,
post-COVID era?
definitely the disease has shown some changes in its prevalence, its incidence, and its type of disease. Because even I know that before COVID era, we got usually one or two lesions in a patient of coronary artery disease. Now we are getting multiple lesions. Like even the young patient have three artery vessel blockage. However, the cause is really not confirmatory, but many scientists have said it that it's a genetic change, and the change by itself caused by the mRNA vaccine of the COVID that causes the inflammatory changes in the our body endothelium and vessels. So it's increased. But I think by de-stress ourselves, by keeping the other factors in control, we can reduce it to very much extent.
So, Dr. Amit, not only the viral toxicity you mean to say led to this, but even the post-viral treatments. I mean,
Yeah,
the
yeah,
treatments.
definitely steroids have major,
Steroid has played an important
yeah,
role in increasing these and increasing
incidence
the,
of diabetes
if not
also,
directly, they increase the diabetes
diabetes,
incidence, and that indirectly
blood pressure,
actually increase
hypertension.
the heart diseases. So we can, there is a link between
Yeah,
the
definitely.
post-COVID and heart diseases, and we should consider that also to mitigate
Yeah,
it.
but that is not modifiable now.
Yes.
So we have to think more of the modifiable factors, and we should regularly visit the doctor at least every third month or 6 month at least, because we as a patient, yeah, as a young person don't know what is going in our body. A doctor however cannot 100% diagnose a disease, but many times they suspect and they can treat it at the earlier level many times.
So, Dr. Amit, as today is the World Heart Day, we will take opportunity to another epidemic which is on our doorstep, so which has already arrived. Not only diabetes or hypertension, but and we were talking about the disease related to plaque. Actually, we were talking about the ischemic heart diseases, but we want to listen your views about the epidemic which we are facing in terms of heart failure also. Do you, the patients with heart failure has increased in your opinion?
Definitely increases. They are increasing because the death rate of treated coronary artery disease is lower now, but they are accumulated, they are going accumulated. As I have said that after angioplasty or bypass surgery you are not definitely treated, you are in the going in the continuous process of having disease. So definitely they will increase, and the burden of heart failure will increase in coming time. And now India is the most prevalent country of for heart failure patients, and it is going around 60 million.
So unfortunately, Dr. Amit, we not only are on the top of the table in terms of diabetic patients, in terms of the cardio, in the heart disease patients, but heart failure patients also, like we are talking. So we are on the top for all the wrong reason when it
Heart
comes to
failure
heart
is the
disease.
consequence of all of the coronary artery disease, hypertrophic cardiomyopathy. So it is like a terminal feature of a disease which is long running in our body. So we have to control it at the preventive level.
So again, the risk factors are the same. The cardiac disease is itself, heart disease itself is a risk factor for heart failure, Dr. Amit. And all these genetic factors, all these hypertension, diabetes, and diet, and everything, and inactive lifestyle, deprivation of sleep, stressful lifestyle, as you mentioned,
Obesity,
obesity. Obesity is another epidemic which we are.
yeah.
So we are called thin fat Indians, Dr. Amit. So can you explain about that also a bit? Like, it is not necessary if we are thin built that we are healthy.
Yeah, Indians should have lower BMI than another persons or to compared to the developed countries, and also they should be more leaner and thinner, and despite being thin they have to do exercise regularly also to get the disease away. And dietary factors and de-stressing their self is very important.
to Dr. Amit to explain it in a simple term, भैया पतला होने से ही सारा काम नहीं बनेगा. आपका बॉडी में लीन मास और फैट मास का जो रेशो है वो भी प्रोपोर्शनेटली रहना चाहिए डॉक्टर अमित. मतलब हमारे को फैट मास ज्यादा ना हो, हमारे को लीन मास जो मसल्स और
Yeah, muscle mass is a preventive factor in coronary artery disease, in diabetes, in developing hypertension. So the more is muscle mass, it is more beneficial for the patient.
and preventive
Yeah.
also in nature, Dr.
Yeah.
Amit. So, and again, it comes to diet, how to increase the muscle mass, Dr. Amit. So, we have to improve our diet, we have to improve our exercise, give time to ourselves for
Yes,
exercise,
yes.
de-stress ourselves again, do some kind
Yes,
of
the
yoga
working
meditation.
of a person should not be like ki we are getting salary and we are getting disease also. We should take the salary but not the disease, not the stress.
Wonderfully said.
This is my
You put it in so beautiful in the words. I mean, salary doesn't mean that you have to carry a stress.
Yeah.
Right? Salary means that is a mean for your family to earn the bread. It absolutely doesn't mean you should carry stress with it. So employer should not hand over stress to the workers together with the salary. I mean, that's very important message which Dr. Amit has sent today through this awareness program. So, Dr. Amit, thank you very much for this
Thank you.
wonderful conversation. And I think this program will surely raise the awareness to the next level in our population and make.
Yeah, general people wants to know how we can prevent it, how we can detect it, what we should do. So these things are important. Definitely.
So thank you very much, Dr. Amit,
Thank
for
you,
your
Dr.
contributions
Paramveer.
towards that.
Thank you.
And once again, wish you all a very happy,
Hard.
I should say healthy world.
Healthy. Hard.